Yeah, for some reason it's going well. It's just stopped. Thank you very much. Okay, so we have a topic about antibiotics. So what is antibiotics? We have a definition here. You can read through it. I just want to say it's very simple. Metabolic products from one microorganism to kill or inhibit another microorganism. Okay, so here we want to say something. What is one microorganism? This most likely is yeast. More possible is molds. Let's say penicillium generates penicillin. What is another microorganism? Bacteria. And how we say Q? Cyto. What means inhibit? Static. So that's the very simple definition. What is antibiotics? And we gave you some of the examples right here. Penicillin from mold, penicillium, the tetracycline from streptomycins. There is one exception here. Sulfur-laminated. Sulfur drug. Sulfur drug you absolutely heard about in the other classes. We talk about competitive and non-competitive inhibition of the enzyme activity. This is a chemical synthesized drug, but we still belonging this to antibiotics, although it's not fit this definition. Now, originally, those antibiotics coming from natural, but when you see those in the markets, or you get from your prescription, from your pediatrician, or from the doctors, for adults, for kids or adults, those are basically is already being chemical modified or synthesized. Okay, so just want to let you know, sulfur drug is antibiotics, but it may not fit the definition because it's a chemical synthesized. Some other things, what's a chemical therapeutic agents is a synthetic chemicals administered to people, animals for treating disease. Antimicrobials, they may be natural or chemical synthesized. We have lots of natural antimicrobials. Let's say you have berry. The berry could generate sorbic acids. That's one example. You have a lemon. The lemon could generate citric acid. And you have cheese. Okay, that's manufactured, but they definitely have a lactic acid. Lactic acid there. So these are all the examples. A little bit about the history. This is the question is in the exam 1, practice exam. I said we're not going to talk about by the time because we're going to do right now. Is Paul Ehrlich to discover the salvarsan is a treatment of the syphilis. It's by the time they call it a chemotherapy, but right now you talk about chemotherapy, most likely it's for cancer treatment. So in 1912, people already have the way to do the syphilis. In 1929, Fleming discovered the first antibiotics, which is penicillin. Then, 1944, we have streptomycin against tuberculosis. So I mentioned lots of times. Before antibiotics comes out, tuberculosis is equal to cancer by the time. You got it, you basically, there's no treatments. In China, we treat, in the old time, they tried lots of the traditional herbs and the medicines, it doesn't work. The only thing that works is antibiotics, but certainly it's used a lot, so there's a multi-drug resistant tuberculosis species will be generated. Chloramycetin, this is the first broad spectrum antibiotics, which means they are effective for both gram-positive and gram-negative. Now, since 1950, we use a lot. And in the United States, I think we control in a very appropriate way. So, for example, you have a flu-like symptoms. You go to see a doctor. He will usually, what they do is a very quick test. They swab into your nose and to see whether it's streptococcus. For example, streptococcus pyogenes. If it is streptococcus pyogenes, they were using antibiotics. And if you doesn't have that pathogen, it could be a virus, just a cold. So the doctor, most of the time, will not write a prescription of ampicillin or penicillin to you. So in control here, we're very well, but some other countries, they may have any symptoms, flu-like symptoms, they will prescription with antibiotics. So I think in here, we control it definitely very well in a good environments, but more or less, the antibiotic resistance issue is still happening. So a couple of years ago, I did a small project. I just collected a sample from WVU Health Science Center, the surrounding area, the soil sample, the pond water sample, and I go to the lab, I testing the antibiotic resistant, I find there are multiple samples carrying antibiotic resistant bacteria. Okay, so just want to let you know. This is what happened for antibiotics in bacterial media. So in the bacterial media, you see the colony there, the smear there, you put the antibiotics, you see a transparent zone surrounding it. That makes us thinking about it is inhibit and curing a bacteria. So that's an example. Okay, characteristics about antimicrobial drugs. First of all, it could be selective toxicity. And they can kill or inhibit the bacteria, but we also want to be their side effect for the human being or for the animals will be as little as possible. The second one is therapeutic dose. That is the drug level required for clinical treatments. We certainly want to be the smaller the better. So antibiotics ideally is in a microgram level. Toxic dose. It's a drug level at which drug becomes too toxic for patients. Therapeutic index. That's toxic dose and divided by therapeutic dose. Okay, how do you think this number should be? Therapeutic dose should be the smaller, the better. Toxic dose, the larger the better, is that right? The greater the better. So, what will we end up with this therapeutic index should be the more, the better. The greater, the better. Okay? Side effects. Using antibiotics, we have side effects, more or less. So, in using penicillin, if you still remember, in the older time using penicillin, we have to do a skin test first. We want to see is their skin allergic. If you have allergic to penicillin, you cannot use it. And sometimes using other antimicrobials, you could see a yellow eye, you see a yellow teeth, and you even see the white blood cell is dramatically decreased, which means they may do something for the bone marrow. So that's side effects. Okay, narrow spectrum drugs. That's only attack a few different pathogens, which means they only effective for gram-positive or gram-negative. Broad spectrum drugs effective for both gram-positive and gram-negative. And the last two items we mentioned, the cyto is killing the microbes, static inhibits the growth of the microbes. So this is some characteristics for antimicrobial drugs. The next question, several slides, is talk about how we test antibiotic efficacy. In other words, is the resistance of antibiotics. The first one is called a Kirby-Boer test. And this we will do in the lab. So, what happened? I have an agar, and this agar is very special. It's not like a neutron agar. It's called Muller-Helton agar. Muller-Helton agar. Okay, so you're going to put the bacteria there. I'm going to put the bacteria there. Now, how many bacteria you're going to put in there? You need to have standards. It cannot be too low, cannot be too high. We usually say 0.5 McFarland standard. What this means, roughly 10 to the 8 cells per ml. That's a concentration. And then we using the dispenser gonna be adding the disc onto the agar surface. And the disc usually will be right TE10. What this means, TE means tetracycline, 20 is the concentration, is microgram. And then you add it there, we do the incubation. At 35 degrees Celsius, 24 hours, we will going to see whether there is an inhibitory zone. It could be very small, it could be huge, like this. And then we do the measurements. And there is a standard for that. If you more than one standards, we will say this bacteria is susceptible for certain antibiotics. Susceptible. So in the antibiotics area, when we talk about that, we don't say sensitive. We usually say sensitive is our human being reaction to the antibiotics, basically is an allergic reaction. For the bacteria to antibiotics, we will say it's susceptible. So let's say this is tetracycline. I got the diameter is 23 millimeter. Then I'm going to look at the table. The table comes from American Antibiotic Association. They have 3 ones, 15, 20, 21, for example. This end up with 23. It's more than 21. It is susceptible. If I have another bacteria, and I find that the inhibitory zone is only 10, for example, that is less than 15, so we say it is resistant, which means tetracycline is not going to work for this pathogen at this specific patient or animals. But how about 20? This usually is we call intermediate. Okay, so you can see the Kirby-Boer test. It is a semi-quantitative test. They give you some of the number, but it's not exactly tell you the minimal inhibitory concentration. A second example is the E-test, and I'll just use the slides to explain to you. So the E-test is, instead of you have the stick, the paper stick, you put a strip there. And the concentration of the antimicrobials is from high to low. And then you're looking for the first intersection. It is the intersection between transparent zone and the turbidity area. That is called MIC, which is minimal inhibitory concentration. Minimal inhibitory concentration. That's called MIC. Okay, so that's called the E-test. It is also a semi-quantitative test. Okay, more detail related to minimal inhibitory concentration.